Hello everyone. Today we will talk about the management of status asthmaticus. Status asthmaticus is also known as severe acute asthma. Bronchial asthma is chronic inflammatory disorder of airways in which breathing is periodically rendered difficult by widespread narrowing of the bronchi. In bronchial asthma, the narrowing of the bronchi is reversible bronchoconstriction. The clinical features of bronchial asthma are recurrent episodes of wheezing, breathlessness, tightness of chest, and cough. Severe acute asthma is the most severe form of bronchial asthma. It presents with severe dyspnea, unproductive cough, sweating, central cyanosis, tachycardia, and pulsus paradoxus. During an attack of status asthmaticus, the patient will present with increased respiratory rate with use of accessory muscles of respiration. Patient will have an upright position with fixing of shoulder girdle to assist the accessory muscles of respiration. There will be increased pulse rate. Patient will talk in words, not in phrases or sentences. On auscultation, you will find high-pitched inspiratory and expiratory rhonchi. Now, the management. First, we will perform a quick initial assessment, take a brief history of the patient, perform rapid examination, assess the severity, and administer high concentration oxygen of 40 to 60%. The algorithm for the management is first administer short acting beta 2 agonist, that is SABA, through MDI or nebulizer, 1 puff every 10 minutes, that is 10 puffs, single nebulization. Then look for response. If there is symptomatic relief or increase in peak expiratory flow rate, continue with SABA every 6 to 8 hours for next 24 hours. If there is no response, give oxygen. If SpO2 is less than 95%, start oral prednisolone, dose of 1 to 2 mg per kg. Then assess the patient after 1 hour. Then look for response. If response is positive, continue SABA every 6 to 8 hours for next 24 hours. If there is no response, nebulization of salbutamol and ipratropium and injection of hydrocortisone should be given. Then assess the patient after 2 hours. Look for response. If response is positive, SABA and oral prednisolone should be given for 5 days. If there is no response, administer injection of theophylline and IV infusion of MgSO4. Assess for response. If there is still no response, shift the patient to ICU and mechanical ventilation should be started. Thank you and have a nice day.